Good afternoon. Can everyone hear me? So, as Vida mentioned, I'm based at the Mail and Guardian, and we have a sort of a strange health desk. And the reason why it's strange is because it's pretty big. We're about 20 people because we donor fund it. And we get most of our money from the Bill and Melinda Gates Foundation and from the German government. And because we are few people, they sort of have to take notice of us at my newspaper because it's just we're too many people to get past. We take up half the office. So we're larger than the political desk, larger than the business desk, and we can do nice things, such as not believe any scientist or any health minister when they state a statistic that it's necessarily true. We would ask, we have time to go and look for the original study of where you found the statistics, and if we then publish the story on our website, we actually have enough resources to go and find the link to the study and hyperlink it so that scientists and policymakers and people like you can go and check whether it is correct. And we can do one other nice thing, and that is we can get opinion pieces from people like you and rewrite them and edit them so that they are accessible to the general public and work with you, so that it's not just our opinions or our stories on the website, but also scientists and policymakers who can do that. So I want to talk about two types of stories that have been covered. I'm going to talk about the MMR vaccine in the British media and the HIV Dissidence Debate in South Africa, and see what we can learn from that and how we can come to sort of solutions, how the media can cover science issues better. Now, many of you, I suppose most of you, know who Ben Goldacre is. He's a doctor and a person who regularly criticizes the media or analyzes how we cover science. And most of you would also be aware of the anti-vaccination campaign around the MMR vaccine, that is the measles, mumps and rubella vaccine that went on in the British media in the late 90s. So there was a guy called Andrew Wakefield, and many of you would be aware of that, who published a research paper in a very reputable medical journal, The Lancet, that claimed that there's a link between autism and the MMR vaccine. And in the media, the story played out more or less like this. Journalists reported that autism was becoming more common, but no one knew how to cure it and no one knew why was it more common. And then they knew there was this doctor called Andrew Wakefield who has done research on it, and that there was some sort of link that he claimed between the MMR and jab and autism. They reported on more scientific research that had been done to confirm this link, which didn't quite confirm it, and there was also research that debunked it, but that research wasn't really reported on. And then everyone thought you shouldn't get these jabs together, you should get them separately. And then there was a very interesting parallel thing happening with that, and that was Tony Blair, who people thought he didn't give his young son Leo that was born the vaccine because he refused to confirm whether the baby at that time had received it or not. And there was a lot of speculation going on around this because those of you who have followed Cherie Blair, and Tony Blair was the Prime Minister at the time, Cherie Blair has quite a few New Age beliefs, and she believes in crystals, and she believes in pendulums that you can swing. It is said that Tony Blair went with her to one of her ladies called Sylvia, who was sort of an intermediate, and the pendulum was swung to see if it would be safe to go to Iraq to war. And so people were really, and this Sylvia had very particular views on vaccines, so it was a big issue. People saw it as a yardstick if Tony Blair confirmed, sort of like if he confirmed, then MMR was valid, and if it didn't, then maybe there were doubts around it. So what did the media do? Well, or what were the real facts? So the paper was eventually retracted, first only partially and then most of it. And there was definitely no link between MMR and autism, and it became very clear that this type of study that was done was not one that you could derive any causal any cause and effect from, and that he only had 12 patients, and then in the study, and then a journalist from the Sunday Times called Brian Deere revealed various things in the media that then made it clear that this guy couldn't be trusted. One of the things was that he had been paid hundreds of thousands of pounds to collaborate with a group of parents who wanted to take the pharmaceutical company that produced MMR and the British government to court because they claimed their children got autism because of this vaccine. And then it also emerged that Andrew Wakefield was involved in a patent for a vaccine that related closely, a new patent for a new vaccine that related closely to the study. So as a result of it, it's very clear from various studies that when the media covers health interventions, it has a serious effect. Many studies show if certain health interventions are covered in a positive way, then the use of it goes up after the positive coverage, or it goes down after negative coverage. And in 2008, the MMR vaccination rates was as low as ever in England, and in some parts of London, only 60% of children got covered. By 2008, the highest number of measles cases in England and Wales had been seen since surveillance methods had started in 1995. And Ben Goldacre argues that the greatest tragedy of the media's MMR hoax is that it was brought to an end by these issues being made public, these issues being the stuff that the investigative journalists uncovered, when it should have been terminated by a cautious and balanced appraisal of evidence at the time. Now we would ask, why did that not happen? So very interesting things emerged from a study that was done by the Economic and Social Research Council in 2003 in the UK. And the most interesting part of their findings was that they looked at major science stories that was covered over a period of 10 months. And of all the major science stories in the publications, they found that 10% of this coverage was on MMR. But the interesting thing was that when it came to a science issue that had been politicized, it was no longer covered by science reporters. It was taken over by political reporters and the editors of newspapers. During this MMR coverage time, newspapers had policies on MMR. Editors had opinions on it. And as a result, a lot of the scientific facts were captured incorrectly. And when a scientific issue becomes political, it starts to be covered beyond the science pages. What happens when people have opinions about these things? They write in letters to the press, and you start to write opinion pieces and also editorials in the newspaper. And who writes those? It's not always the science person. It's very often the political people and the editor of the newspaper. So 80% of the coverage of MMR had been done by political reporters and editors and not science correspondents. If you look at what drove that coverage, why was it so widely covered? One aspect was blame. No one knew what caused autism, and no one knew what the cure was. So it was a very strong news value and something that people really wondered about. When it comes to pharmaceutical companies, it's often bad people or people with a very profit-driven agenda. So it really fitted into that moral template of big corporations can be dodgy. And perhaps the strongest news value that you can get is controversy. If something is controversial, it's really driven to front-page news coverage. And then there was something that we always look for in a story, the human element. There were these desperate parents who were pitched against very bland scientists who didn't have media training. And of course, there was Leo Blair. Did he have the vaccine or didn't he have it? And there was quite a limited amount of scientific understanding when it comes to how vaccines are developed and what studies can find and what they can't find. And Goldacre says a very clear shortcoming of this coverage was that if you sideline specialist correspondence when science becomes front page news, there are very predictable consequences. He is also quite upset about the fact that it wasn't just that science correspondents didn't cover the story. It was also that they weren't even consulted as resources in their own newsrooms and asked what they thought of story angles. Now, of course, we have to ask, why were they not consulted? Was it only the newspapers? Or did they make themselves not heard? Or did they not interact with the newsroom in such a way that they were taken seriously beyond a sort of scientific story in a silo? And that's something that we can discuss later. So I now want to move on to the HIV dissidence debate. You're all very aware of the Thabo Mbeki and Mantu Shabalalams among HIV doesn't cause AIDS debate, but it didn't start off in South Africa. It started long before in the United States. I was recently, 2 weeks ago, in San Francisco at the Science Journalism World Conference for Science Journalists. And there were 2 site visits that we could do, one to the University of California in San Francisco and one to Berkeley. And the program at San Francisco was actually interesting, more interesting than the Berkeley one. But I went off to Berkeley. And the reason for that was because I wanted to see where a guy worked that made my life hell when I was a HIV reporter at the SABC in the 90s and 2000s. And that guy's name was Peter Duesberg. Many of you would know that Peter Duesberg was a very credible scientist at a time. He's the guy who discovered the retrovirus, and that is the group of viruses that HIV belongs to. And a few years after that, he changed his mind. He decided while HIV was still a retrovirus, it couldn't possibly cause any harm and couldn't cause AIDS. If you look at how this debate was covered in the United States, it's very similar, with very similar motivations for coverage as in South Africa, but it wasn't a mainstream issue. It was very much limited to the gay media. Why? Because the HIV epidemic affected gay people, especially gay men, disproportionately. So it was more of a reality. But on top of that, there was a context in which this happened. Ronald Reagan was the president at the time. He was a Republican. He was quite anti-gay. And there was a guy called Robert Gallo who claimed he had discovered HIV, but it then emerged, he's the co-discoverer of HIV today, that there was another guy in Paris from a much smaller institute than the very powerful National Institutes of Health that Robert Gallo worked for, that sent him a virus that he isolated, and people, to make it simple, Robert Gallo stole the virus, is what some people would say. And the politics around it became so heavy that it's the only virus in the history of mankind where 2 countries had to sign a contract as to who discovered HIV. They co-discoverers today. So it happened against a really serious political background of controversy. So as a result of that, the New York Native, which was a very well-known gay publication, followed theories of HIV that didn't have a lot of scientific backing, but because they felt they were fighting against a government that wasn't very pro whatever they believed in. And Duesberg became along the way, and as a result of that, of all these things happening in the background, there was a story in 1987 on the front page which said, "Which man is right?" And the men that they were talking about was Robert Gallo, an HIV discoverer, and Duesberg. And this story pitched them as equals, as if what they believe Robert Gallo might have had his personal issues of how he treated another guy, but his science was solid. And the community within New York then started to think, who read that newspaper, because they were pitched as equals, that Duesberg and Gallo has views that weigh equally heavy. Then later it went on to the UK. There was a lot of anti-gay movements and conservative movements that didn't want to believe that HIV could possibly be transmitted heterosexually. And really, in 1994, the AIDS dissidence debate was over. It had no more news value. But 5 years later, it arrives in South Africa because our president was approached by someone who told him about this debate, and he basically fell for it. So, similarly as in the United States, there was a lot of politics with HIV already. There was the Serafina 2 scandal, which was a play that was paid for by the government while Nkosazana Zuma was health minister, and a lot of the money had disappeared, and the HIV prevention messages in this play was really not very scientific. And there was the Varadine scandal, which was an industrial solvent that was promoted by 2 researchers from the University of Pretoria. And Thabo Mbeki and Nkosazana Zuma really supported these 2 researchers. There was no proof for what they had found, and practically dissolved the Medical Control Council to be able to get ethical approval, which they didn't get, but to try and push it through for research. And in our country, this dissident debate had more consequences than in the United States, because it was driven by a far more high-profile person, a president, and on top of that, it had a direct influence on policy. People couldn't get access to treatment because the president and the health minister, Manto Shabalala Mzimang, along the way, then didn't believe that these drugs were, the side effects of them far outweighed the positive things that they could do. So what did the media do? Very, very similar to what happened in the UK. There were health correspondents reporting on it, but also political people, and it became a political issue and a very racialized debate. So when it came to health correspondents, there was quite a bit of an understanding that it was a ludicrous debate. But in South Africa, health correspondents had far less of a scientific background than those in the United States. Most of us were caught off guard. We didn't know there was a dissidence debate, and we had almost never heard of AZT at the time when it emerged, because HIV treatment was not available in South Africa. That's where activists came in and really, really played a strong role and educated us. But there was a lot of discrimination against health correspondents. Pat Sitley from the Business Day at the time was the welfare editor. The editor of Business Day was Peter Bruce, and he was very pro-Mbeki. And she literally resigned in the end because he countered her so much, criticizing her about her stories, that she just couldn't stick it out. There was a really great journalist at the Star, Lynn Alton Roxell, who exposed the health minister keeping a Medical Research Council report away from the public with very bad HIV figures in there. And she was banned from press conferences by the health spokesperson. And on top of that, she received very threatening SMSs. And then you may remember there was Charlene Smith, who wrote for the Mail and Guardian, who had been raped and then wanted to have access to AZT as a preventative measure and couldn't access it and wrote about it, and then was really criticized by the president, and there were several inexplicable burglaries happened at her house, and she was also once driven off the road and followed by someone. So it was really quite a dangerous time if you were very critical. When it came to political reporters, they did treat this as a debate of equal sides, and because this happened shortly after we became a democratic country, there were a lot of interpretations that if you were critical of the president, it could be interpreted as a racial issue, that you were either white and didn't understand what the debate was about, or you were black and you were a traitor. Whichever side that were, there was a lot of tensions around that. And if you look at newspapers like The Citizen, there was an editor who strongly supported dissidents, carte blanche, broadcast an interview with Thabo Mbeki that he gave to a dissident journalist in London that they bought from that journalist to broadcast. Martin Wells, who's the editor of Newsweek, published a series of dissident reports, and he was quite vocal on supporting them. And then you had publications like The Star, where there was Lynn Alton Roxell, who would file great reports, and that would be scientifically accurate, but at the same time there would be letters and columns that completely contradicted in the same newspaper because the editor were quite sympathetic towards these dissidents. If you compare the two, the MMR coverage and HIV, you would see that pretty much the same things drove the coverage. It's controversy, there was little scientific understanding, there was a fight against pharmaceutical companies or something that would feed into that fight, and no one knew how would you, what is the cure for HIV or autism, and whose fault is it that there is this big epidemic. Now we can look at what can we learn from it, and are there any solutions? Well, I don't know if I've got all the solutions, but I can give you my idea. So obviously, if we look at what Ben Goldacre said, we do need specialist correspondents. We need people in the health world who can understand health issues and who have the time to file proper stories. But the problem is media houses can't afford them, especially if you want to do stories in depth and spend a bit more time on them. So one solution to this is what we do, donor-funded journalism, and we're not the only donor-funded journalism organisation in the country. There's Ground Up, Nathan is here from Ground Up, that does great development journalism. There's Health E. But as people who do donor-funded journalism, we will tell you that it has its own pros and cons. It's my responsibility to find all the money for all the 20 people that work for us for their salaries. The Mail and Guardian does not pay any of those salaries. And there's also a lot of admin that comes with donor-funded journalism and managing the donors, just like you who do research have donors. Then, of course, we can argue that we need training. But I see a lot of training happening that's funded by donors. And I really don't think the way to go is to train people in science or in health issues for that matter. I think when you have this training, it's far more important that you train the journalists to translate that knowledge into stories. That is the skill that is lacking. They can go and read the science and the health information, and they can get it from experts. I would say when you do a training like that, it should be 80% storytelling skills and 20% science. The thing is, it's also often not done by the right people. I see many journalism trainings happening that's run by public health officials that have no journalism background. They somehow get the funds in Washington, D.C. or wherever people hand out money and then run these trainings, and I don't think it's that useful. I think that needs to be changed. I also have seen quite a few trainings being run by people who are journalists, but they've never been mainstream journalists, and then want to teach other people how to tell stories in newspapers they've never worked for themselves full time. And I think that does more harm than any good. I think you need to get the right people to do this, to train them. I'm a science journalist. I don't think science deserves to be published anyway just because it's accurate. If you cannot tell the story in a compelling way, it does not have to be in the newspaper, it does not have to be on a television news bulletin. It is possible to make science compelling. It is not true, in my opinion, that you can't make it compelling. This whole HIV dissident debate is like a suspense novel. You can make a thesis out of that, like it's interesting. You can really make, and I'm going to give you a few examples of what we've done. One of the things that I think we need to do is the days of just telling the same sort of format story is over. You have to do what works today. And today people they consume most of the media, in fact, online. So you have to do things like, you can't just tell a normal news story or just a feature. You have to practice different forms of journalism. You have to produce videos. you can do podcasts, you have to use data, and you can do long-form journalism that many people no longer do. You can do narrative long-form journalism, and I'm going to give you examples of what has worked for us. Of course, you need resources for these things. You can't go and do it if you're the only person at a newspaper reporting it, but you can do some of it. So here is a story, a 5,000-word story that we published on banting when Tim Noakes was really in the news. Now, how do you get people to read the science of food, of how many carbs you need to take in and if fat is good for you or bad for you? It's boring if it's not news or if it's not told in a compelling way. So we visited a clinic in Hout Bay that was actually a clinic for drug addicts. But they also had a section for people who suffered from binge eating disorder. That's when you eat food in large binges and you really have no control. It's a mental illness. And you really have no control over how much you're going to eat. So we visited that clinic and found a case study who was willing to talk to us and was put on the banting diet and followed her for 6 months to see if it worked for her. Combined with this, we interviewed Tim Noakes, we interviewed scientists who didn't believe what he believed. The idea of the story was not to take sides. The idea of the story was to explain the science around these things in a way that people would continue to read. It worked very well, the banting diet, for this case study initially. In the end, it didn't work. She couldn't maintain it long for more than 6 months. But it gave us an opportunity to mix what was happening to her and combine that with science that people would never have read otherwise. Now today you can't pretend that someone read a story. You have online figures that can show you. It's very, very clear. Someone reads it or they don't read it, and they tell you how long people spend on this story. This story in 2013 was our top story. We're quite a small publication, and we sort of aim for policymakers. So we aim for influential readers rather than many readers. So when we get 30,000 or 35,000 hits on a story and people spend an average of about 10 minutes on the story, that's quite a long time to spend on a story online. And this story consistently still get hits because it sort of reads a little bit like a suspense novel, sort of like combined with the science. You will know that that if you go outside, well, first of all, the African, the ACDP earlier this year asked that they want to change the law on termination on pregnancies, and they want people who want abortions to go and submit an ultrasound, although it's in a way already required, but not in the way that they want them to do, to sort of staple it to your consent form. And they also want people not to be able to have abortions at a later stage of pregnancy when it's still legal today, arguing that you can correct or fix disabilities, which is some disabilities or some things that go wrong you can very well fix in a first world country, but not necessarily in a country like ours in the public sector with a lack of access to resources. On top of that, you get people who have many, many unsafe abortions because of all these stickers that you get for illegal abortions in a country where it is legal. So at Bhekisisa, we are quite passionate about having safe abortions. So we're not really interested in the moral issue of whether abortion is right or wrong. We're interested in have a legal one, have a safe one, and want to help you to get access to it. So last week we published this map. The health department has absolutely no updated list as to where you can find abortions in the country. So we worked with the provincial departments to get what they think, where you can find abortions. And we published that map in March, and people told us it was incorrect, which meant that we went to phone all 300 clinics, or 450 that are supposed to offer abortions. Ourselves, we acted as patients, and we got the contact details and whether they actually do provide abortions or not. And we have this interactive map that is called CISA map that we've published, and that you can go online and click on a dot and get the right information. Because in a way that counters pseudoscience, because these stickers that you get on everywhere tells you that abortion is as easy as a pill unsupervised by a doctor, and it's not true. We would rather help people to get access to the right ones. And then we make videos. So LCB spoke about the measles outbreak earlier this year, and many people argued, people were asked for their children, go and get a booster shot, and couldn't understand why should I get a booster shot, my child is healthy. So we have our reporters that would do a 1-minute 30 video, they would interview someone and then study the information themselves and talk like a normal person, in very easily accessible language. And this specific video was about what is herd immunity. Why is it important that it's not just your child that's healthy, but everyone around you? And then there was a thing that surfaced earlier this year, Bluetoothing. Have you heard of that? So Bluetoothing is a drug practice. People who use heroin, who inject it, there's a whole thing going on with, if you can't afford the heroin, they argue that you can take someone who has injected heroin, they can take that person's blood and inject it into your own body, and then you would get a high, which is scientifically not possible because there's too little heroin in that person's blood. So we had our reporter do a feature but also a video and interviewed a scientist on how much of this heroin would be in your blood and why is it impossible to get a high. And the reason we did a video is because the drug users would generally be more likely to be watching a video than read a story. What else? And what else can we do? I think, since we've learned from the MMR and HIV dissident debates, we know now that when a scientific debate turns political, what happens? The political journalists start to report on it. So if something like that happens, you need to know who the science journalist is to go out to them, but you would probably also go out to the political journalists and try and educate them. I think there is so much that we can learn from HIV activists. I think they really, really used the opportunity during the dissidence debate to educate journalists. I remember working with scientists like yourself, where I would call someone at 11 at night, a scientist who would almost become an activist because they want to make sure that the right information gets out there. Now, they didn't become activists just overnight. They were taught by activists, the scientists, to become activist-like. And it's interesting, when I contact scientists today, one of those scientists was Glenda Prey, who is the head of the South African Medical Research Council. People like that still sort of have that way of thinking of being immediately available. I can still WhatsApp her, and it's not because she remembers me. It's because she got into that way of thinking of sort of be available. And they were taught by these activists to speak in easily understandable language, and activists really had fact sheets that they gave to journalists to understand things better. I think if you want your stuff to be in the media, I know it's hard to say you're a scientist, you have working hours, but if you want your stuff to be in the media, you need to adjust, and you also need to be available to journalists. And you cannot say that you don't know who the health journalists are if you do health research and you want to be in the media. I find that so often, that scientists complain about what's not in the media, but they don't read the newspaper. If you ask them, name me 2 health journalists, they wouldn't be able to name it because they don't read the newspapers. And I think it's a two-way thing. It's not just the journalists who need training, it's the scientists as well. I've learned to never waste a good crisis. So let me give you an example. Life Esidimeni is a real crisis, right, with all the hearings going on at the moment. It's never been as easy as now to get a mental health story into the newspaper. Just seize the opportunity and see, use a crisis to your own advantage. I think that is what HIV activists did. They also, used a good crisis. And I also think they did a fantastic job of educating journalists better during that time. And I know you complain about newsrooms getting more junior. I think there will always be different levels of journalists. There will be health correspondents, there will be senior journalists, and there will be junior journalists. And you have to acknowledge the reality. The junior journalists are literally going to copy and paste. It's not right, but it is what they do. You can train them to become better, but while they're not better, write a press release that's accurate and nice that will get into the newspaper and copy it and paste it in the right way. I'm not saying that's what a journalist should do, but I am saying that's the reality. It's what some of them will do. So if you have, the better the thing is, the better the news coverage is going to be. It's not what you expect a health journalist to do. You're going to completely deal with him on a different level and not expect them to copy and paste it. But you don't have control over what ultimately happens in such a newsroom. One other thing thing that we did was, Roy Jobson spoke about the complementary medicine legislation, which can potentially be quite hard to absorb. So what we did and it's one of our best read stories today, what we did in our newsroom was we thought, what would people really want to read about when it comes to complementary medicines? To be able to explain to them that none of it gets tested for safety or for efficacy. Sex enhancers, right? So we went to buy the sex enhancers, all of them that we could find, off a Clicks shelf that you can get in a proper shop. And we asked people in the newsroom to try them out and write a review, and then combined it with a new legislation. And do you know that these people got heart palpitations? It wasn't even about it working or not, it was about the safety of it. And because they were young people, because they then tried it out and wrote these things, and we combined it with a new legislation, they tweeted. All the young friends also started to talk about it. And social media, I think, is really something that you just cannot ignore. I've got a very young team. I feel very old when I see how they tweet. But they force me to tweet, and they force me to do Facebook and, get it right. They always one ahead of me when it comes to that. But I really don't think we can ignore that. I'm ending with, we're going to print t-shirts, which we're going to sell, actually. About science. It's another thing a media place can do. That t-shirt says, what do we want? Evidence. When do we want it? After peer review. And then we have our logo on the back. And we also have a t-shirt that we're printing with this logo, Get Your Theology Off My Biology, so that you don't impose your religious views on evidence-based research.